I say yes, it is humiliating. As you can see that especially James, it was issuing the names of the healthcare professionals and giving it to the community. So everyone who will look at that list and find Dr. Buthelezi in that list, they will already conclude that I'm fraudulent. While I am not fraudulent, it's things that they've been doing as medical aid. So it was inhumiliating us and damaged our character as healthcare professionals.
Dr. Moloabi, how do you respond to that? That firstly, what is said there by Dr. Buthelezi is that you were issuing out the names of these medical practitioners that patients should not use. Did you indeed engage in such practices?
Good morning, Tolly, and good morning to the Newsroom Africa viewers. And Tolly, just before I answer Dr. Buthelezi, please allow me to correct something you said earlier on, which is not correct. The government employees medical scheme is registered in terms of the medical schemes and act, and it's owned by members. It is not owned by government, albeit that it is definitely covering government employees. So it is the decisions that are taken in line with the Medical Schemes Act are decisions of the board. So all this that is being said in the media that it is a government-owned medical scheme is incorrect. We account to government. Yes, so please, I think, this has been said widely. Government had nothing to do with the decisions, be it from the time when we approached the court and prayed to be heard first.
Indeed. Well, Dr. Moloabi, let me just, let me come in there, if you will. And I'm sorry to interrupt you whilst you are correcting us on that, but is it not true that the overwhelming contributions toward this medical aid are from government employees?
Like all other medical schemes, generally there's a subsidy by the employer. But the medical schemes, all of them are registered, and the employer does have representation by virtue of, in our case, we have 12 board members, and then 6 of whom are appointed and 6 of whom are elected by members. But at the end of it all, the decisions are taken at management level. I am heading the executive committee, and after being advised by our legal teams, they thought it is prudent that we at least request the court that be given a chance to first respond to the interim findings before they are made final. And that is what has happened.
All right.
I think the narrative that we are blocking the report is not true. May I answer what Dr. Buthelezi has said?
Indeed, please,
in terms of the list. So what happened previously, and this is some years back, is that only after, as I explained, there are 2 triggers that would trigger an investigation. It's firstly a whistleblowing, then there would be investigations, and only if it is found that there was some fraudulent activity would a doctor not be paid directly, but indirectly. And the other trigger would be when the trend analysis using the algorithms that have been in the report is done, and then it's found that it's an outlier, and then there is an investigation. Only after the investigation is concluded and there is evidence that there was fraudulent activity, then a provider would be put on indirect payment. So our members then would go to the providers who are not being paid directly. They would consult with this providers. The providers would not tell them that they are not being paid directly by GEMS. And then when we pay the member, when we pay the claims to the members, unfortunately, as it happens, the members would use this money, and then the doctor is not paid. So when the doctor demands the money, the members would then say they thought it's their money. So the members started asking us that, please let us know which doctors that we are not supposed to go, that you do not pay, so that we don't find ourselves using the money that we are receiving from you. And that is how that list came about. But however, we did immediately after this whole process started, and Dr. Buthelezi will confirm that, we removed that list because we had to consider, the sensitivities that are being raised. But it was not to paint those doctors in a bad light. It was really out of the members asking that they want to know. And that was not widely publicized, and the members would be directed to a specific point in our website. But we have removed that, and I would have imagined that's in the past now.
All right, Dr. Buthelezi, I want you to respond to what is being said by Dr. Moloabi, but I'm going to ask you to hold that thought for the moment. We're going to take a short breather. When we return, you've heard Dr. Moloabi says that it was members of this medical aid company that requested for these doctors who are practicing fraudulently. And so, what will the response be?
Okay, firstly, I would like to indicate this one, that the SC says there were investigations that were done and then they put the doctors on the list. And according to the report of Moloabi, she mentioned that the investigation they were doing, it was against the Constitution, Section 35, from 33 to 35. Because when they investigate you, it's like they were interrogating you. And if ever you don't agree with what they want or say that you must sign AOD, then they will put you on that list. And another thing is that we find those patients that they are alleging that they are the one who come to them and whistleblowers. They will come back to us and ask, why, Dr. Buthelezi, I cannot see you anymore. I have many doctors because I'm responsible for many doctors in the provinces, in different provinces, that they will be saying the patient, they want to see them. But now the James has put them on the list. Not only James, Discover is paying them indirectly. So what he's saying is then is not what we have been encountering in daily living. Yeah. Because that's what we find, that many patients, they want to see us, but now the medical aid, it's like Discovery. It will tell you directly that these are the doctors that we are using or we are going to pay. If they come to me and I'm not the part of Discovery, but I'm not in the part of their list, then they won't pay me direct. Yeah. And this is affecting many doctors. It has affected many pharmacists because they now take the right of the patient of choosing the healthcare practitioners that they want. Yeah. And they must now use the practitioners that they are chosen by the medical aid. I can indicate this by the patient who died, who was needing dialysis and who was using a healthcare practitioner that was black. But the medical aid, they decided that no longer use that black practitioner, but you rather go. They don't even care whether the patient will be able to afford the distance. Is it easily accessible, the health? No, they don't look at all those things. Yeah. They just do as they please. In fact, they become the lawyers, the judges, and the police in those investigations that they've done. So we are happy that Moloabi has indicated that they were against Section 35 of the Constitution.
Dr. Buthelezi, talk to me about the administrators. We understand these are companies that almost act as the middleman between the medical aid schemes and the doctors. What is their role here and how complicit are they?
Okay, what is happening, it's like James, it's administered by Old Mutual, something like that, and others like Discovery, its administrators. One wrong again is that it is in their office. And what we know is that as a medical aid, they are non-profitable things. But what they've done is that they use administrators to gain profit. And the money that they've been taking from the doctors, from the nurses and everyone else, that money, it was the money of the patient, but it has never went back. In fact, what they were doing, those administrators, they will say, in this year, we have managed to get back the money from the healthcare professionals, so much money. And that money, they will give each other incentives. They will give each other bonuses. That money, it doesn't go back to the patients who are the one who are paying those premiums, who the money is belonging to them. So there's a lot of fraud that has been going on that I am happy that today it's well known to the public that when the patient, they come to see me, the medical aid, it will pretend that they paid me, but after 3 years, they will come back and take the money from me, which has led many healthcare professionals to be poor today, losing their houses. Some committed suicide.
Yeah. Dr. Moloabi, let's come back to you. At the heart of this fight between yourselves and the black practitioners is the patient. You've heard how they have been disadvantaged. You don't care. That's the allegation against you. You do not care where that patient sits. They might be in a far-flung area somewhere, but you will instruct them not to use a doctor that is conveniently accessible to them, and you couldn't care less whether they actually get that medical treatment they so urgently need. Why are you so heartless?
Colleague, can I correct things again? I need to,
Please
the
do.
viewers are listening and making decisions on the basis of what you are saying. So I'm sure Dr. Buthelezi didn't mean any, because when he mentioned who our administrators are, it's not Old Mutual, so that we don't get into trouble here.
Okay.
They will want the right of reply. It is Momentum Health, the division of Momentum Health Metropolitan Health Corporate, which is our administrator. And the GEMS model has been an outsourced model. The strategy of GEMS now is to ensure that in the not so long future, and this is in our strategy, it is in our annual reports, that we are going to be moving into what you call an in-sourced model as opposed to the outsourced model that we have been using over the years. What it essentially means is that we are building capabilities to do these things for ourselves as GEMS, but that is in the future, and we are doing that now. Dr. Buthelezi, I have heard you in terms of the findings that you are referring to, and I have said that, and I've been saying this whenever I've been given an opportunity, and this is our commitment, that we are now studying the findings. It's a 300-page report, and we may have meetings every day now to say what is the way forward in response to this. So obviously, procedurally, we will first respond to the findings of the report as they relate to GEMS, and then wait for the final findings and the recommendations. Those recommendations, we have already started having a view of what we think may be where we may have been found wanting.
Dr. Moloabi,
so
I'm going to ask you,
I'm
going to ask you at least, I know that you're going to respond in due course with regards to the content of the Ngugaitobi investigative report, but there is the one issue that I would like you to respond to, and that is that of patients being disadvantaged or almost becoming collateral damage as a result of this fight, if I could call it that, between yourselves and the practitioners that you seek to close out.
Twali, as you know, I am a medical practitioner, and I have made an Hippocratic oath. So patient is the first thing that I do everything in whose interest I do everything. So there is something called care coordination, and if you again go to our report, our annual report, we have introduced care coordination after we have consulted with a wide range of healthcare practitioners. In care coordination, what it simply means is that the member or any beneficiary of the scheme chooses the doctor that they normally go to. We call it nomination. And this now has applied with general practitioners, where you find that the majority of patients were already using one doctor mainly. So they choose which doctor they would normally go to.
Let me ask you to pause there for a moment. Dr. Buthelezi, do you agree with that each patient will choose a doctor that they want to use? Is that indeed what is happening in practice?
No, it's not happening. I myself, I found a patient that I've seen giving the service, but when I'm claiming, I'm told you have used the wrong service provider. So I'm the wrong service provider, and I didn't know. I was never informed. So sometimes these things, you find them very late when you have seen and you've given your service to the patient. The next thing, when the patient, they come again, you say, no, your medical aid doesn't pay me. Patient, they become frustrated. So this, it must also go to the communities, that when the healthcare professional says, your medical aid doesn't pay me, or your medical aid is paying you, or your medical aid, it says you must not see me, but see a certain doctor. Fight it for yourself as a community. You have a right to go to CMS and fight it, that you want it. You have a right. The right of South Africa allows you to choose whoever you want, whoever hospital you want to use, whatever ambulance you want to use. We have a right to healthcare services. We shouldn't be chosen by other people.
Dr. Moloabi?
Can I respond?
Yes, please, go ahead.
I'm just a bit surprised that Dr. Prudence is not aware that two of our options are based on networks. And I know that, and I'm not going to be, I think it's only fair that we don't talk about any personal things. So in general, the doctors who claim from GEMS are on our network. We have more than 6,000 of the GPs claiming from our networks. And I think the practicing GPs are in the region of, not the registered, the practicing ones who are claiming from GEMS are in the region of about 8,000, thereabout. So Dr. Buthelezi, I can always, because I do talk to her, she says she doesn't know. I'm a bit surprised, because the network is very wide. It's not only GEMS which uses network. So our members who generally have nominated will then use that doctors if they're at home. But if you happen to be maybe on holiday and you're in Durban and then you fall sick, we have provision for members to see any doctor wherever they are. And that is really the truth that is happening. So, but may I just say that the care coordination, its intention is not to deny the right of choice. The choice is made by the doctor, by the member themselves or their beneficiaries. And then in emergencies, they can use any doctor. And that is how that model happens. Patients are never denied access to a doctor. There are instances, and this is my last point, Polly, on this matter. There are instances where, as Dr. Prudence says, where claims may not be paid. And there are many reasons. Sometimes the most common one is when the funds are exhausted due to benefits having been used. What we have also found that is that care coordination that I've just explained, it actually reduces doctor hopping. Doctor hopping is basically when today I've got a cough, Dr. Buthelezi gives me medication, then I go to another doctor tomorrow, I say this medicine is not working.
All right.
They give me a medicine which is the same, but then it costs you more, and then the benefits get exhausted much better.
All right. Dr. Moloabi, unfortunately,
much earlier,
we're going to have to end it there. Thank you very much to the both of you. Dr. Stanley Moloabi, Principal Officer at Medical Aid Company GEMS.